My institute in Palm Springs is called the International Heart and Lung Institute. Now, the reason that is, most people maybe know that cardiothoracic surgeons not only take care of the heart, but also take care of the lungs, and for that matter, the esophagus, the swallowing tube. So part of who I see in my practice are lung patients and asthma sufferers. And so I want to dive into what we now know about asthma, where it comes from, the triggers. Most people think about asthma because of all the inhalers they see on TV, and that if you have asthma, a puff of this magic inhaler is all you need, and there's really nothing else you can do about it because, well, sorry, you're just a person with asthma. But believe it or not, asthma is connected to something far deeper than that. It's actually connected to your gut health and your immune dysfunction and chronic inflammation. I'll give you an example that I think is useful to think about our immune system. Our immune system is, if you will, our policeman of our body. They're always looking for criminals, troublemakers. Part of my training was in London, England, back in the mid-1980s. And at that time, policemen, bobbies in London, did not carry guns. They actually just had a nightstick. And quite frankly, that's all they needed. Now, of course, police, wherever you go, are walking the streets in a Kevlar vest with an AK-47, that their finger is on the trigger. In fact, we often walk by the presidential palace in Paris, and there are many police officers, infantry around the presidential palace. And I always like to point out to my wife that, yeah, they're all in Kevlar vests. Yeah, they all have an AK-47. And as I point to my wife, I said, look at where their finger is. Their finger is actually on the trigger. And she'll go, oh my gosh, you're right. Well, why? Well, because we now live in a society with constant terrorist threats. And that constant threat is so prevalent that we're literally got our finger on the trigger. So what? When I was growing up in the 1950s and 60s, everybody brought a peanut butter and jelly sandwich to school. Peanuts were handed out as snacks. Peanuts were on airplanes. And yet we know that about 95% of human beings carry an inborn antibody to the peanut lectin. And yet nobody had an EpiPen reacting to peanuts. Now, of course, if somebody brings peanuts to school, 3 kids are pulling out their EpiPens, injecting themselves. What gives? Well, back in the 1950s, our immune system was basically walking around with a billy club because the immune threats were so low and our gut wall was so good and our gut microbiome was so good that they didn't have to worry. Now, on the other hand, because our gut microbiome has been destroyed, the information they give to our immune system is not there anymore. Our gut wall is porous, and our immune system now is exactly like those troops in front of the presidential palace. Our immune system has got a Kevlar vest, an AK-47, and their finger is on the trigger. So now a little nothing lectin, like a peanut lectin, is viewed as a hostile threat, and we're firing at it. So we now know that the lung has actually its own microbiome, and that the lung immune cells are getting their information from the immune cells in the gut. About 80% of all your immune cells are down in the gut because that's where mischief happens first. But there's constant communication between the gut microbiome and the lung microbiome. There's constant communication between the immune system in the gut and their compadres, their associates up in the lung. And this communication system happens in multiple levels of communication. We now have unlocked the code of how the immune system talks to each other. So if the immune system in the gut is in trouble, they want to let the immune system in the lungs know that trouble is on the way and anything suspicious should be met with a very strong response. So it's the inflammation signals from the gut that actually make the airways reactive in the lungs, not the other way around. So most of us have heard asthma, have seen asthma. I treat asthma all the time. It's obviously wheezing, shortness of breath, many times chest tightness, and oftentimes chronic coughing is a sign of asthma. So many people with asthma also have a history of allergies, of eczema, of sinus issues, of food sensitivities, and digestive problems. And so many of my patients with asthma, one of the first things that strikes is that these kids, when they were kids, got multiple doses of antibiotics as children, maybe for ear infections, maybe for coughs, maybe for sore throats. Maybe they were treated for strep throat, wasn't a strep throat. But so many of these kids, and now adults, were treated with multiple rounds of antibiotics. And what we now know is that totally wiped out their gut microbiome. And so there was no good communication between the microbiome and their immune system. Also, we know that kids who are born with cesarean section have a much higher incidence of asthma than kids who are born normally. Now, many children have to be born by cesarean section, but they don't exit the birth canal, the vagina, and pick up the mother's microbiome. And in fact, kids who are born with cesarean section actually have a microbiome that's actually skin flora based for the first 6 months of their life. So they're really behind the 8 ball in terms of having a normal microbiome. Also, we know that kids who are born on farms have almost no history of asthma, whereas kids who are born in inner cities are much more susceptible to asthma. And that's because the kids on the farm were exposed to multiple sources of microbiomes, the animals, the plants, the forests, the fields, that the kids in inner cities are never exposed to. So they don't get a normal functioning microbiome like the kids on the farms. The hallmarks of asthma is this chronic airway inflammation. These guys are always locked and loaded, and they're always ready to overreact to what would normally be not a very threatening condition. So what I do with my asthma patients is I work on restoring their gut. And every one of my asthma patients has leaky gut. No surprise to me. So we get rid of the usual offenders. We get rid of ultra-processed foods. We get rid of excess sugar. We get rid of artificial sweeteners. Now, people say you got to get rid of seed oils. Well, first of all, let's not throw all oils from seeds under the bus because they're actually very good seed oils. For instance, flaxseed oil is a seed oil, but it's almost pure alpha-linolenic acid, which is an omega-3 fat that actually is phenomenal at damping inflammation. Canola oil is a seed oil, but organic canola oil is about 25% alpha-linolenic acid. And the rest of it is almost all oleic acid, the same oil in olive oil. Now, there are some bad seed oils: soybean oil, corn oil, cottonseed oil, sunflower oil. They're loaded with short-chain omega-6 fats and very little omega-3 fats. But don't just throw seed oils under the bus. There's some really good ones out there. You want to increase polyphenol-rich foods. Polyphenols feed friendly bacteria. You want to get prebiotic soluble fiber in these people's diets. You want to support butyrate production. One of the things that's very scary is we're seeing, as most people know, a huge increase in colon cancers in 30 and 40-year-olds. We're seeing an increased rate of lung cancer in people who have never smoked. And a lot of this is owing to the fact that we no longer have gut bacteria that produce this very important short-chain fatty acid called butyrate. And these gut bacteria, to produce butyrate, have to have soluble fiber. To give you a contrast, we know that most hunter-gatherers eat about 150 grams of soluble fiber a day. 150. The average American eats about 4 to 5 grams of soluble fiber a day. That's a huge difference. And it's no wonder that if our gut bacteria don't have the starting blocks with which to make butyrate, it's no wonder that butyrate levels are incredibly low in most of the patients that I first see, because we just are not feeding the gut bacteria what they need to make butyrate. So butyrate is also a great communicator to the immune system. And butyrate is another one of these postbiotics whereby our gut buddies teach the immune system that they don't have to be armed to the tooth. They can take their finger off the trigger. As we joke, they can go to the donut shop and have a cigarette and a donut and not be prowling the streets looking for troublemakers. Anything that calms the immune system. Speaking of which, vitamin D is essential to calm the immune system. Vitamin D tells the overactive immune system, get your finger off the trigger. You don't have to be so trigger happy. And vitamin D is low in almost all asthmatics that I see. And so getting vitamin D, which is easy to do, it's one of the simplest supplements you can add to your diet because they're so small and so effective. Now, there are other triggers. I certainly see that houses are sadly full of mold, dust mites, chemicals that are leaching from our fire-resistant fabrics, our fire-resistant clothing, our bedding, and all of these, which would have never been an environmental trigger if our immune system was normal, now can act as a trigger. So all of these things have to be dealt with. Most of the times we get our patients, to get a HEPA grade filter for their home, preferably in the 2 rooms where they spend most of their time, which is usually the living room, kitchen, family room, and the bedroom. And these things are economical and they make a big difference in getting rid of these environmental toxins. Try to get better, cleaner household products. We get to sleep with the windows open, no matter what, even if it's the dead of winter, wherever. Not a bad idea, except if you live in an inner city where the outside pollution may definitely be worse than the inside pollution. Once you lower the cause of inflammation, once you lower the overreactive immune system, The great thing is that the asthma resolves in most of my patients, and we can wean them off of their inhalers. We can wean them off of their drugs. So this is not a condition you're born with. This is not a genetic issue that you get the wrong set of cards. This is manipulable. And just like everything else, this massive amounts of asthma we're seeing, we never used to see this long ago before our modern environment. So asthma is complex, but even really difficult asthma, if I'm addressing that, and again, it's the International Heart and Lung Institute, I work from the gut up to the lungs, not the other way around. And that's the take-home message. Reduce the inflammation that's coming from the gut, and the inflammation in the lungs calms down.